So good evening, everybody. My name is Mr. Alan Matus, and I am a nurse educator. I have been teaching students for almost 25 years. I'm also a nursing faculty at this time. I help students pass their licensure examination for the NCLEX and at the same time pass a nursing program as well. And also, I am the founder of Matus Nursing Review and Matus Nursing Review Online NCLEX Academy. Now, if you don't know yet as well, I am the author of my published book in Amazon, and that would be the title is Simple, Fast, and Easy NCLEX Review that you can find in Amazon, of course. So it's now available also in the Philippines. You can email Matus Nursing Review Academy@gmail.com to find out how you can order the book in black and white in the Philippines, everyone. So, okay, so again, that is my book in Amazon. So if you are willing to give a testimonial, please, on the comment section for those of the copy of my book, I will appreciate that, everybody. Okay, all right. Okay, so I would like to give a shout out to the first few people who came in tonight. As usual, I do that. Okay, so let's see. We have the following people: Claire Abad, thank you very much for being here. Amaka Oti, Vivian Okoyi, Presel Dagdagpaz, Kitty Foria Lentil, Delphine Badarnen, Troy Katakian, also Marie Regine Boni, Teresa Shokonbi Momo, Neil Haynes, and also Nat Enna. Okay, so thank you very much for being here tonight, everyone. And joining me, I have prepared several questions for you on delegation and then also prioritization, everybody. Okay, so our first agenda for tonight is going to be our motivational photo of the week. Okay, so our motivational photo of the week, this is actually our tumbler, our steel tumbler, and this was sent to us by our student Raquel, and she's working out in the gym, and she took a photo of it and then posted in social media and also sent us a copy of the photo. So thank you very much for sending us this photo. It is our motivational tumbler. It says, "I can do it and nothing will stop me." So you can actually buy this tumbler in our merchandise store also, everybody. So I think it's a very nice reminder of your goal every day, which is to pass your NCLEX examination. Okay, so that's a very nice one. And then also, I would just like to give a quick announcement for our upcoming schedule this April. We have the 10-day live comprehensive NCLEX review webinar, and that is an interactive online NCLEX review to master your nursing core content. So this is a review program for those who graduated many years ago and they want to master their nursing core content. And when you enroll in the program, you will have a workbook and at the same time an access to our online NCLEX Academy. The next review schedule will be on April 24 to June 26, 2021. That will be from 8 to 4 p.m. and that would be a Saturday class, everybody. Okay, so visit our website, Matus Nursing Review Academy.com, in order to enroll in the program if you're interested. Okay, so another one, of course, we would like to announce our sale for tonight. So our sale is going to be our April Fool's Day. That actually started yesterday, March 31 to April 2, 2021. We have a 50% off for our self-study comprehensive online NCLEX review course, which is the 1-year unlimited online access NCLEX review. That would be $249 only and $50 instead of $499. And also, we just added today, we will have again, because of the increasing demand for discounted workbooks, so we added also today 30% off for our NCLEX Success workbook. That would be only $66 instead of $94.50. So this sale is going to end tomorrow, everyone. It's only until April 2, and we don't know when it's going to be our next sale again, everybody. So grab this limited time offer while it is available. Okay? All right. And of course, for tonight, we're going to have your free 90-day online access NCLEX review raffle. So you make comments, okay, in the comment section, and then you will be entered in the raffle. Okay. Now, for those who are currently enrolled in our online NCLEX Academy, if in case you win, we will add 90 days to your subscription. Okay, so that will be the agreement. We will add 90 days to your subscription, everyone. All right. So I would like to ask everybody: are you all now ready for our NCLEX prioritization and delegation for tonight? I would like to find out if you're all ready, everyone. Say a big yes. But I can see there's a lot of comments in the comment section. So let's try to find out what the people are saying here. Okay. All right. Okay. So we have first time joining, but I have been watching on YouTube. Thank all for your help. That would be Edna Nyaribo. So thank you very much for being here tonight. All right. So we also have Dale Tacon is watching as well. We have Louis Martinez. I'm gonna give a shout out to all the students who are joining us tonight. Okay. So if you haven't done yet, everybody, I would like to encourage you to share or subscribe. If you're watching on YouTube, share this also on Facebook if you can, everybody, so that everybody will also benefit from the Facebook Live, everyone. Okay? So always remember that your NCLEX prioritization and delegation is part of your test plan under management of care or coordinated care. Okay? So management of care for the RN test plan, and for the NCLEX test plan, that would be coordinated care. So obviously, you may receive a few of these questions in your NCLEX, or you may receive a lot of these questions in your NCLEX examination. Okay. All right, so everybody, are you ready for our first question for tonight? Okay, our first question, everyone, let's go ahead. But we have a lot of messages in the comment section. Okay, all right, and I'll answer those questions in a moment. So let's have the first question, everyone. Okay. There's a question about the book and the workbook. Basically, they have the same content. The only thing is that the workbook is it contains exercises and fill in the blanks, so that when you're watching the online lectures in our academy, you can write on the workbook. So that's the difference, the format. But basically, they have the same content. Okay? So the question is, the nurse cares for surgical clients in the post-anesthesia care unit, or PACU. Which client needs to be assessed first? A, the 26-year-old client who developed hoarseness of the voice after a subtotal thyroidectomy. B, the 56-year-old client who complains of a swollen right arm after a radical mastectomy. C, the 24-year-old client who reports stump pain after an above-the-knee amputation. Or letter D, the 35-year-old client who has slight bleeding and swelling of the stoma after an ileostomy surgery. Okay? All right, I'll read the question again. The nurse cares for surgical clients in the post-anesthesia care unit, or PACU. Which client needs to be assessed first? A, the 26-year-old client who developed hoarseness of the voice after a subtotal thyroidectomy. B, the 56-year-old client who complains of a swollen right arm after a radical mastectomy. C, the 24-year-old client who reports stump pain after an above-the-knee amputation. Or D, the 35-year-old client who has slight bleeding and swelling of the stoma after an ileostomy surgery. And can you please put the rationale why A is the answer, or B is the answer, or C or D, or why the other options are not the answers? Why? So that we can do a shout out and share your rationales, if they're correct, on the screen, everyone. Okay? So, and then also, can you tell me from which country are you coming from, everybody? Okay? From which country are you coming from? Because I know we are international. Okay? All right. So, let's have the answer for the first question for tonight, everyone. Okay, so some people are still answering right now. Okay. What do you think is the answer, everyone? A, B, C, or D? Okay. All right, so let's have the answer, everybody. Now, what do you think is the answer to this question? Basically, you have situations here wherein you have to see all of these patients. However, which one do you think takes priority? Your B, C, and D are options, or A are options that you need to see. However, which ones can be delayed? Which one is your priority? The first one. So let's see. Okay. All right. So the answer to that question, everyone, is going to be, that would be letter A, everybody. So A is the answer. So I think 99% of you are correct. It's going to be letter A. And why is A the answer, everyone? Because Nadu, you are correct. Because when you have hoarseness of the voice after subtotal thyroidectomy, that may indicate the presence of damage to the laryngeal nerve, recurrent laryngeal nerve. So we need to further assess and find out what's going on. Okay? So we need to address this immediately so that we can do interventions and report to the provider. So the answer is going to be letter A. It doesn't have anything to do with respiratory. It has something to do with damage to your vocal cords. Okay, not vocal cords, but the main explanation is damage to the nerve, basically, which is the laryngeal nerve. So that causes the person to have hoarseness of the voice. Now, your letter B, let's go to the other options. Your letter B, a swollen right arm after a mastectomy, that could be a priority as well, because lymphedema is a possible complication of radical mastectomy that involves removal of the axillary lymph nodes. So once we remove the axillary lymph nodes after a radical, the keyword is radical, meaning that we remove the chest muscles, the minor and the major pectoralis muscles, plus axillary lymph nodes. So that would lead to swelling. Okay, and we need to address that as well by elevating the arm on a pillow. Okay, now your letter C, stump pain, is something that we need to address as well. However, this can wait. Okay, stump pain or phantom pain can be a common effect of amputation. So we need to address that as well. However, A is more important. Now, your letter D, slight bleeding and swelling of the stoma immediately after ileostomy surgery is expected. Okay, that's an expected finding after ileostomy surgery. Okay, so again, A takes priority. Okay, and we need to make sure that for letter B, that swollen right arm should be elevated. Okay, elevated and adducted. We're not supposed to abduct the arm after surgery. Okay, so just remember all of this rationalization, everybody. And again, this goes back to your concept review, your content. So you have to know the complications of thyroidectomy, which are number one, respiratory obstruction. Okay, you have your accidental removal of the parathyroid gland, you have hemorrhage as well, and your laryngeal nerve damage as well. Okay, so thyroidectomy is a favorite in your NCLEX. So study that topic very well, everyone. Okay, all right, so congratulations for those people who got the question right. Okay. Okay, so we have some students who gave the rationale. Thank you very much for that. We're gonna have the next question, everybody. Are you ready? Okay, so question number 2. All right, so number 2 question for tonight. Okay, before anything else, I would like to give a shout out to Abedimi Sola, and she's coming from Maryland, USA. Okay, we have also from other countries. We have from the Philippines, Chris Raval. Okay, Delphine Badarnen is from Bahamas and also Kentucky. Okay, and also, okay, what about the others, guys? All right, so let's read the question. The nurse is assigned to care for clients in the oncology unit. Which client requires immediate intervention? A, the 56-year-old client who develops nausea after receiving chemotherapy. B, the 38-year-old client with cervical cancer who reports that the radiation implant may have fallen out. C, the 45-year-old client who complains of rashes on the chest due to external radiation. D, the 65-year-old client who has red, tender, and swollen skin around the chemotherapy port. Okay, again, the nurse is assigned to care for clients in the oncology unit, which client requires immediate intervention. A, the 56-year-old client who develops nausea after receiving chemotherapy. B, the 38-year-old client with cervical cancer who reports that the radiation implant may have fallen out. C, the 45-year-old client who complains of rashes on the chest due to external radiation. And D, the 65-year-old client who has red, tender, and swollen skin around the chemotherapy port or the access site. Okay, so what do you think is the most important here? A, our priority, who requires immediate intervention? Okay, all right, so what do you think is the answer, everyone? A, B, C, or D? And thank you very much for some of the other people who just joined. Hi, Janine Lobaton. Thank you very much for being here. We also have, Alfred Satablada. Thank you very much for being here. Hani Pasamonte, Oni Alfonso, Edna Nyaribo, Mulu Hadera, Punke Adikunle. We have Yoshika Singh. We also have Merlin St. Flavin. Baby Jean Alemane. I think I know Baby Jean Alemane Duque. Okay. Mayo Sarmiento. We have Galina Nikitenko. Hi, Mai. How are you doing? And Amaka OT. So the answer for this question, everyone, is going to be, let's see, everybody. Okay. All right. You might be surprised of the answer, everybody. Okay. So the answer is going to be, I think I have very smart students tonight. Very good, everybody. I think 99% of you, again, got the correct answer. Excellent. Wow. So we have your letter B as the answer because why? When the implant is dislodged, we all know that we have to protect the client and at the same time, the caregivers, of course. We have to protect the caregivers from being exposed. Okay? So we have to prepare always at the bedside your container, okay, radiation-proof container, and at the same time your long-handled forceps to pick up the implant and then place that in the container and make sure that we notify the radiation department. Okay, so that's radiation hazard. So the issue here is not airway, the issue is not breathing, it's not circulation. The issue in terms of prioritization is going to be safety. So you see, not all prioritization questions in the NCLEX will be all about airway, breathing, or circulation. Okay, some prioritization questions could focus on safety as well. Not only safety in terms of radiation. Okay, other examples of safety will be infectious diseases. Okay, even if it's only a suspected infectious disease. If the client is manifesting the symptoms and we are suspecting, we have to immediately isolate the client, especially in the emergency room, or it could be in the regular unit. We need to isolate to protect others immediately. Okay? It could be your chickenpox, it could be your tuberculosis, it could be your COVID. So those are some of the other safety issues. Okay? Another safety issue that could be a priority in the NCLEX will be a client who is thinking of committing suicide, for example, or harming himself, or harming others, for example. Those are also immediate priorities, everyone. Okay? So just remember that sometimes it's not airway, it's not breathing, it's not circulation. Sometimes it could be also safety. Now, your letter A, who develops nausea after receiving chemo, we need to address that. However, that can be delayed. Okay? That could be a priority, especially if your patient is having severe vomiting. Of course, we have to prevent dehydration, right? Now, letter C, somebody who complains of rashes, we need to address that, but that could be delayed as well. Skin rashes may happen after external radiation therapy because of skin sensitivity. However, that can wait. Now, letter D, you have your red, tender, and swollen skin around the chemotherapy port. Actually, letter D is an important situation as well. You know why? Because it's infection. And we're talking about a cancer patient. And then you have infection of the access site. So definitely D would be the next priority here, because the next thing we do not want to happen to someone with cancer and under chemotherapy is someone who will be developing infection, especially that most patients who are on chemo, or let's say not just most, but all of them are at risk for infection, or they are immunosuppressed. Okay, so that's why the answer is going to be letter B, everyone. So congratulations, everybody, for getting the correct answer on that one. That'll be your letter B, your brachytherapy or your dislodge radiation implant. And I discussed all of these concepts also in the online NCLEX Academy. All right? Okay, so let's have the next question, everybody. Okay, so shout out, let me see, before we go to our delegation question, everyone. So Alfred is watching. Okay, we have Marie Halcon Rivas. Thank you very much for being here tonight as well. Okay, for being here. And of course, we appreciate your presence here for tonight, everyone. Okay, for our session. Okay. Also, we have Kehendi Adetunji Gyayi Simori. Okay. Then we have Camille Ann Pangilinan as well. So thank you very much for being here. Okay. All right. So let's have the next question, everyone. And I hope all of you are ready for our next question, which is your delegation question. Okay, your delegation question. So let me see if you can answer these questions, everybody. All right. Now I do have one question. My question for tonight is, what is one thing that you are grateful for? When you're reviewing for the NCLEX, it's very important to erase negative thoughts, to eliminate them, the negative thoughts. And sometimes you feel down, sometimes you feel discouraged. So what is one thing that you are grateful for, and that will motivate you to study for your NCLEX? So answer that in the comment section. So here is our next question, everyone. Which task can be delegated by the registered nurse or RN to the unlicensed assisted personnel or UAP when caring for a client placed on a bladder training program in the nursing facility? So we're talking of a nursing home or nursing facility. Okay. A, offer the client to drink fluids. B, complete the bladder training assessment form. C, explain the purpose of bladder training program. D, record the times the client urinates. E, develop the care plan. F, help the client ambulate to the toilet. And G, change incontinence pads. Okay? Again, which task can be delegated by the registered nurse to the unlicensed assisted personnel or UAP, or let's say your nursing assistant, when caring for a client placed on the bladder training program in the nursing facility? Select all that apply. A, offer the client to drink fluids. B, complete the bladder training assessment form. C, explain the purpose of bladder training program. D, record the times the client urinates. E, develop the care plan. F, help the client ambulate to the toilet. And G, change incontinence pads. So we have some people responded to my question actually, and they mentioned about Vivian Okoye said, grateful for the privilege to learn and others people's success story. Very good. So we need to get motivated, okay, and pass the NCLEX, everyone. Always positive thoughts. I always believe that you attract what you expect. You attract what you expect. So meaning that if you send out a message to the world, okay, or to the universe, that you want to pass your NCLEX and you expect that, you will attract that and it will happen. So that's something that you need to think and something that you need to apply. Because the first step in preparing for the NCLEX is to believe in yourself that you can do it. Okay? So always remember that, everyone. So what will be the answer to this question? Okay, so I'm grateful. I'm understanding the concepts. Very good. All right, and we do have also another one from Pastor Nicolas. His message is, the opportunity to care for patients physically and spiritually motivates me. Of course, because we have to take care of patients not only physically, but also spiritually, meet their emotional needs as well, their religious needs, their cultural needs as well, because our approach is holistic. We need to care for the patient, not only meeting the physical needs, but the whole aspect of the patient. Okay? So let's have the answer to this question, everyone. It seems like everybody is almost having the same answer to this question. So that's great because you'll be having this question in the NCLEX. Okay? So the answer, everyone, is going to be A, D, F, G. Congratulations, everybody. Okay? All right. So that would be A, D, F, G. Now, why? Why is A the answer? Offering the client to drink fluids is within the scope of practice of the UAP or nursing assistant. Letter D, record the times the client urinates. That's part of your bladder training program for the nursing assistant or UAP to document or record when the patient urinates or when the patient is incontinent as well. So we need to know that because we need to know the pattern of your patient so that we can do interventions. Letter F, help the client ambulate to the toilet. Correct. Letter G, change incontinence pads. Congratulations. All right. Now, what is the purpose of a bladder training program? Your bladder training program is a toileting program, the goal of which is to help the patient or the client establish a regular pattern of evacuation and to prevent incontinence. Always remember that incontinence is tied to or related to fall incidents as well as your urinary tract infection. So, especially in nursing facilities, it is regulated, okay, or mandated that all residents of nursing facilities must always be screened for the bladder training program, okay, if they are good candidates or not. So the screening, which is the complete the bladder assessment, training assessment form, your letter B, that form is being completed by the licensed nurse, by your registered nurse, okay, to determine if the client is a good candidate or not. And that form also is being discussed definitely with the healthcare team because your toileting program is a multidisciplinary approach, okay? Your letter C, explain the purpose of bladder training program to the client. That would be your registered nurse, okay, of course, because that is your teaching. Your letter E, the care plan, we have discussed that all over again over here. Developing the care plan, creating the care plan, modifying the care plan, reviewing the care plan, revising the care plan. That's all for the registered nurse, okay? The UAP and the licensed practical nurse or LPN can make suggestions and carry out some of the tasks in the care plan. But the overall captain of the care plan who develops that will be your registered nurse, of course, okay? And that's under management of care. Now, of course, hopefully you understood, what is a bladder training program. We also have the bowel training program as well for clients who have bowel incontinence as well. Okay, so what are some of the interventions for a bladder training program? Number one, we also need to identify the type of incontinence of our client. Remember that there are different types of incontinence. There is what you call stress incontinence, urge incontinence, functional incontinence. We have different types of incontinence. We even have overflow incontinence. So we need to determine the type of incontinence, okay, in order to properly intervene to our patient. And examples of interventions in bladder training program, okay, and it will be individualized for each patient. Not all patients will have the same schedules, will have the same approaches, but generally we encourage patients to go to the bathroom. We ask them if they have a need to void, We encourage patients to increase their fluid intake as well. Okay, and we need to properly monitor the times that they are urinating. Okay, and of course, immediately answering call lights when patients have to go to the bathroom. Okay, so that's it, everyone. So hopefully, when you are reading questions on bladder training program and bowel training program, please further read more about it, because this is a very important intervention for our patients. Okay, no one wants to be incontinent in a nursing facility. If a client is a good candidate and there's a chance that the client will develop a regular pattern of voiding, the client will become continent, then we have to do everything that we can to help that client to regain continence. Okay, because incontinence is tied with several complications like UTI and even your fall incidences. Okay, all right, so that's it, bladder training program. So are you ready to our last question? For our last question, everyone? Okay, all right, so we have a okay, response here. Let me see. Okay, we are grateful. Okay, Loretta said we are grateful. Mr. Matus sent us out to help many aspiring nurses to fulfill their dreams. Thank you very much. So thank you very much also, Loretta. So we're gonna have our last question for tonight, everyone. Okay, all right, so let's go. All right, so let's have your last question. Okay. Our last question is going to be delegation. Okay, delegation again. So which task can be delegated by the registered nurse to the licensed practical nurse when caring for a client with kidney stones? Select all that apply. A, strain the client's urine. B, administer hydromorphone intravenously. C, check the food tray for appropriate diet ordered. D, assess pain characteristics. E, evaluate response to pain medications. And F, apply a hot compress to reduce pain. Okay? All right, continue. Which task can be delegated, all right, by the registered nurse or RN to the licensed practical nurse when caring for a client with kidney stones? A, strain the client's urine. B, administer hydromorphone intravenously. C, check the food tray for appropriate diet ordered. D, assess pain characteristics. E, evaluate response to pain medication. And F, apply a hot compress to reduce pain. Okay, all right. So read the question carefully, everyone. Okay. So always remember also that a very important intervention for kidney stones will be to identify the composition of the stone, if it is an acidic stone or an alkaline stone. And if the stone is acidic, for example, for example, caused by uric acid, when you have gouty arthritis, then if it's an acidic stone, then the diet should be alkaline ash diet. So to prevent further stone formation, we actually adjust the diet of your patient. Okay? And that's really very important to take note. The differences and the foods included for an acid ash diet and alkaline ash diet. All right. So we have your answers, everyone. Most of you have very good answers. Let's see. Okay. All right. So this is delegation to the LPN, everyone. Okay. We do have a very special message here from Loretta. So she said, I developed my confidence in each question with your guidance and very thorough explanation. So thank you very much for that, Loretta. I appreciate that. Okay. All right. So the answer to this question, everyone, is going to be, all right, so that would be your A, C, and F. All right, who got perfect tonight, guys? Okay, I'm really very happy to getting the correct answers here. So A, straining the client's urine could be delegated. Of course, we strain the urine, and we have to instruct the LPN to once the urine is strained and a stone is passed, then we have to send the specimen to the laboratory. So the LPN has to report that to the RN to make sure that we send a request to analyze the stone in the laboratory to find out the composition. If it is calcium oxalate, if it is calcium phosphate, if it is magnesium oxalate, if it is due to uric acid, for example. So we need to find out, especially knowing if the stone is acid or if the stone is alkaline. Now, letter C, that is within the scope of practice of an LPN. Checking the food tray if it has the right type of foods for a specific diet, of course. That will be letter C, that is correct. Letter F, applying a hot compress, definitely that is a nursing intervention, and that's within the scope of practice of your LPNs to be able to apply a hot compress to reduce pain in a client. Very good. Now, you have your letter B, administer hydromorphone intravenously. The word intravenous disqualifies that as something you can delegate because intravenous means that's only for the RN. Okay? Although hydromorphone is your, let's say your brand name is Dilaudid, it is an opioid or narcotic. Letter D, assess pain characteristics, assessment of pain characteristics, a comprehensive assessment, that would be for the registered nurse assessment. Okay. E, evaluate response to pain medication, evaluation, that should be for the RN. So remember again our acronym EAT, EAT, evaluation, assessment, teaching, that is supposed to be done by the registered nurse. Okay. I do have a question. Which kidney stone is more painful, the small one or the large one? Can you answer that in the comment section? Which kidney stone will be more painful, the small one or the large one? What do you think? Okay, which kidney stone? All right. Okay. Can an LPN hang a piggyback? Well, it depends, but I told you again that LPNs in the NCLEX are not supposed to deal with intravenous, okay, especially medications. In some states, LPNs can only handle intravenous electrolytes if they have undergone training and certification. Okay, all right. So the large one is more painful. Actually, it's the small one. And then also for clients with kidney stones, especially if it's a small one, in order to pass out the stone, we actually encourage the client to ambulate, okay? And can someone tell me also, what is the terminology for the severe pain when you have kidney stones? What is the terminology for the severe pain because of kidney stones? What is our terminology for that? Can someone tell me before we finish this question, everyone? Okay, so that would be your renal colic, okay, renal colic, all right? Okay, so put your scores, everybody, and congratulate yourselves, okay? Pat yourselves on the back if you get a perfect score tonight, all right? But before anything else, also, I would like to plug in our program. So we have the Matus Nursing Review Online NCLEX Academy. We do have classroom classes as well, but we have the COVID pandemic right now, so we don't have classroom classes. We do have the live webinar every Saturday that will start on April 24. And then also we have the self-study program. So if you're a very busy person and you would like to review self-study, join our hundreds of students online. So you're gonna have a workbook, and then you will have a checklist and a calendar to follow. The workbook is only $66 right now, and our programs for online access would be different prices, okay? So we have the 3-month access, we have the 6-month access, and also we have the 1-year access. And of course, we have hundreds of NCLEX quizzes online as well. And you have access to all of the videos that we have here in the Facebook Live. We put all of them in the online NCLEX Academy, okay? All right. And also, if you want to be a part of the Matus tribe, and also to always think positive and always to get motivated and to get that reminder every time you can purchase our merchandise products. And the latest that we have right now is this steel tumbler. And a lot of our students really like this. Please order as soon as you can because we're running out of supplies of this. So you can just visit our website, matusnursingreviewacademy.com, to buy these products. Okay? All right. And lastly, our winner for last week was Nadu Nadu. Okay? So Nadu Nadu won the 90-day online NCLEX Academy access. So please give your congratulations to Nadu Nadu everyone. Okay? All right. So okay, so thank you for sharing your knowledge. Thank you very much, Nell, for giving your comment. And all of you down there, I'm going to give responses later on, everyone. And again, have a happy weekend. And then thank you for joining me tonight. And if you want to ask more information about the sale, we're going to put the links in the comment section and also the discount codes, everyone. But again, thank you very much, everybody. Again, this is Matus Nursing Review. Online NCLEX Academy as well, wherein we make your NCLEX review simple, fast, and easy, everyone. Have a good night, everybody, and take care.